Welcome to the Deep Dive. Today, we're tackling a subject that probably affects more pet owners than we think, even if it's not always easy to talk about. We're talking about fecal incontinence in dogs and cats.
Exactly. It's a sensitive one.
It is, but we're going to use the veterinary guide to fecal incontinence to, walk us through it. We'll look at causes, the signs, and how vets figure out what's going on.
Yeah, the goal is really to make this information accessible. It can be worrying for owners, so we want to break down the veterinary insights in a clear way.
Less jargon, more understanding, so you feel better equipped if you ever encounter this.
Precisely.
Okay, let's start with the basics then. Fecal incontinence. What does that actually mean in veterinary terms?
At its heart, it's pretty straightforward. The pet can't control their bowels properly. They pass feces unintentionally.
Right, it's accidents.
Exactly. And the guide usefully splits this into two main categories, which helps understand the why. Reservoir incontinence and sphincter incontinence.
Okay, reservoir incontinence, the name kind of says storage, right?
You got it. It's about the rectum, the final holding area for feces. With reservoir incontinence, the rectum either can't hold as much stool as normal, or it's not as stretchy, not as compliant.
And why would that happen?
Usually because of some underlying disease affecting the rectum or the colon nearby.
Okay, so as an owner, what signs might make me think, could this be reservoir incontinence? What am I looking for?
Well, the guide notes these pets often seem to feel the urge to go a lot. So you might see more frequent attempts to defecate. Importantly, it's usually a conscious effort they're trying to go, not just leaking stool passively.
Ah, okay, so they know they need to go, but maybe it's difficult or happens too often?
Right. They might strain, seem uncomfortable, maybe even painful. And sometimes you might see blood in the stool. Frequent, deliberate, perhaps difficult trips to the potty spot. That's the pattern.
And the underlying causes for this reduced storage, what kind of diseases are we talking about?
The main ones are colorectal diseases. Things like colitis, inflammation of the colon, or irritable bowel syndrome, IBS, even growths or tumors, what vets call neoplasia.
Okay.
And also, sometimes just severe diarrhea can overwhelm the system. The sheer volume is too much for the colon to handle properly.
Like a plumbing backup almost.
Sort of, yeah, too much input for the system.
So if I bring my pet in with those signs, what might the vet find during the physical exam? What points towards reservoir issues specifically?
During a rectal exam, the vet might notice sensitivity or pain in that area. They could potentially feel irregularities like masses or thickening of the rectal wall.
Okay.
But here's a key point for differentiating. The anal sphincter muscle tone, the tightness of the exit valves, basically, and the anal reflex, that little wink or twitch response,
Yeah.
those are usually normal in reservoir incontinence. The problem isn't the exit door itself, it's the waiting room.
Got it. That's a really helpful distinction. Okay, let's shift gears then. Sphincter incontinence, what's different here?
So, like the name suggests, this time the problem is with the exit door, the anal sphincter muscle. It's not working right. Either it's physically damaged somehow,
Okay.
that's called non-neurogenic, or the nerves controlling that muscle aren't sending the right signals. That's the neurogenic type.
Nerves or physical damage. Got it.
And the guide also mentions some supporting muscles nearby. The levator ani and coccygeus can also be involved. It's a whole system.
Right. So what are the telltale signs for this type? What would I see at home?
The big one here is involuntary leakage or dribbling of feces. Owners often notice it happens when the pet isn't trying to go, maybe when they're sleeping or walking, or sometimes when they get excited, bark, or cough.
So it's passive. They don't seem aware it's happening.
Often, yes. That lack of awareness is key. That's why vets ask really specific questions like any history of nerve problems, any injuries near the tail end. Was the pet properly house-trained? Is the defecation truly involuntary, or are they trying?
And you mentioned nerves. What about other signs?
Yeah, a really important clue the guide points out. If the pet is also leaking urine, that strongly suggests a neurological cause affecting both systems.
Okay, that makes sense. Nerves controlling multiple functions down there.
Exactly.
So let's break down sphincter incontinence further. If the vet suspects the non-neurogenic type, the physical damage, what might they find on exam?
They'd be looking for physical evidence, maybe signs of past trauma around the perineum, the area surrounding the anus, or things like perineal fistulas. Those are like little abnormal tunnels that can form there.
Okay.
The anal reflex, that twitch, might still be present. But the sphincter muscle itself might not close completely because it's damaged.
And for the neurogenic type where it's nerve-related,
Yeah.
what are the exam findings then?
Here, the vet might feel decreased muscle tone in the sphincter, though the guide warns that's not always a reliable sign on its own.
Right.
More significantly, that anal reflex might be weak or maybe even completely absent.
Ah, okay. No nerve signal, no reflex.
Pretty much. And this is where a full neurological exam becomes critical. The vet will check tail movement and tone, look for pain in the lower back, the lumbosacral area. They'll assess hind limb strength, reflexes.
Trying to pinpoint where the nerve problem is.
Exactly. Is it in the lower spinal cord? Is it a more widespread nerve issue like a peripheral neuropathy? Or could it even originate higher up in the brain? Weak hind legs plus a weak anal reflex, for example, often points to that lumbosacral spine region.
It really highlights how interconnected everything is.
Yeah.
So what are some common causes for that non-neurogenic type, the physical damage stuff?
Trauma is a big one. Unfortunately, things like bite wounds in that area or anal sac abscesses that rupture badly, lacerations, even gunshot wounds. It can also happen unintentionally during surgery near the anus. That's called iatrogenic injury.
Okay.
And those perianal fistulas we mentioned can also directly damage the sphincter's function.
Right. And then on the neurogenic side, it sounds like there could be a lot of different nerve issues causing this.
There really are. It's complex. Problems can be in the central nervous system, the brain, and spinal cord. Think degenerative myelopathy, spinal developmental issues like spina bifida, trauma to the spine, slipped discs, intervertebral disc extrusion, pressing on the cord.
Wow, okay.
Also tumors, infections, or inflammation like meningitis, even tiny blockages in blood vessels supplying the spinal cord FCEs.
That's a lot originating from the spine.
It is. And then there's a specific condition called cauda equina syndrome, affecting the nerve roots right at the end of the cord. That can be caused by discs too, especially lower down, but also arthritis, narrowing of the canal, instability, infections in the bone.
So many possibilities. What about nerves outside the spine?
Yeah, peripheral neuropathies. These can be caused by infections, immune system disorders, sometimes certain drugs like vincristine chemotherapy. There's also a condition called dysautonomia, or sometimes the cause is just unknown, idiopathic.
The muscle problems.
Muscle diseases, myopathies, or general neuromuscular disorders can weaken the sphincter too.
And you mentioned age earlier.
Yes, absolutely. The guide notes that age-related degeneration is a factor. Muscle wasting, general weakness, maybe some nerve degeneration, even cognitive decline or senility in very old pets can all contribute.
It really drives home that incontinence is usually a symptom of something else.
Exactly. It's a signpost pointing towards an underlying problem.
So how does a vet put all these possibilities together to arrive at a diagnosis for one particular dog or cat?
Well, first, the guide mentions there's no known genetic link or specific geographic pattern, but it does get more common as pets age. A big part of diagnosis is ruling out other things, like standard gastrointestinal upset. That usually comes with other signs like weight loss, vomiting, straining specifically during defecation, pain, maybe blood signs often missing in pure sphincter incontinence.
Okay.
Also differentiating it from behavioral issues. A dog with separation anxiety might soil inappropriately, but you'd likely see other signs like destruction or barking.
Right, different context.
And just plain inadequate house training, especially in young pets, or maybe a cat suddenly avoiding its litter box for some reason. Got to rule those out.
Okay, so once those are less likely, what tests help pinpoint the cause of the incontinence itself?
A range of tests can be useful. Basic blood work and a urine test are usually standard. The bloods might be normal, but the urinalysis is important because a urinary tract infection alongside fecal incontinence could point towards that neurological link again.
Good point.
Fecal flotation is essential to check for parasites. Simple but important.
Always rule out the worms.
Absolutely.
Yeah.
In certain areas, vets might do a rectal scraping to look for specific fungal diseases.
Okay, what about looking inside, imaging?
Yeah, imaging is often key, especially if a neurogenic cause is suspected. X-rays of the lower spine can show disc problems, arthritis, maybe masses, or old trauma, or developmental issues.
And for more detail.
Then you might move to advanced imaging. Myelography uses dye to outline the spinal cord on X-ray. CT scans and MRI give really detailed pictures of the spine, cord, and surrounding tissues. Very helpful for complex cases.
Are there other specialized tests?
Yes. Electromyography, or EMG, measures electrical activity in muscles, like the anal sphincter, to check for nerve damage or muscle disease. There are tests to specifically evaluate that pudendal anal reflex pathway. Muscle or nerve biopsies might be needed in some cases.
Wow.
And if a central nervous system issue like meningitis is suspected, a cerebrospinal fluid analysis, a CSF tap, might be done. For reservoir incontinence concerns, a colonoscopy with biopsies lets the vet look directly inside the colon and rectum.
Quite a diagnostic toolkit.
It really depends on the signs and what the initial exam suggests. You wouldn't necessarily do all of these for every case.
Right. So once there's a diagnosis, or at least a strong working theory, what are the options for treatment and management?
Ideally, you treat the underlying cause. That's the primary goal highlighted in the guide. If it's a slipped disc causing nerve compression, maybe surgery can fix it, and the incontinence resolves.
Makes sense. But what if the cause isn't fixable?
Then management becomes key. Diet can make a big difference. Low residue diets, think bland, easily digestible foods like cottage cheese and rice, or specific therapeutic diets produce less stool volume.
Less volume, maybe fewer accidents.
That's the idea. Feeding at specific, regular times can also help create a more predictable schedule. Interestingly, the guide advises against high insoluble fiber diets as that bulks up the stool, which isn't helpful here.
Okay, good to know. Anything else for management?
Sometimes frequent warm water enemas can help clear out the colon regularly. For some owners, depending on the severity and their situation, managing the pet primarily outdoors might be considered for, practical reasons.
Not ideal, but maybe necessary sometimes.
It can be a quality of life consideration for the household. For paralyzed animals, vets can teach owners how to stimulate reflex defecation, little tricks like a gentle toe pinch or using a warm washcloth on the perineum.
What about surgery for the incontinence itself?
For the non-neurogenic type, where there's physical damage, sometimes surgical repair or reconstruction of the anal area is possible. For neurogenic incontinence, surgical slings using fascia or silicone have been tried to support the sphincter, but the guide notes success rates are pretty variable, not a guaranteed fix.
Yeah, sounds tricky.
And this leads to a difficult point the guide mentions. If the underlying cause can't be treated, the long-term outlook, the prognosis, is often guarded. One study even reported a high euthanasia rate for these cases, unfortunately.
That's really tough.
It is. It highlights why having those upfront, honest conversations with the owner about expectations and potential outcomes is so incredibly important.
Absolutely. Are there medications that can help manage the incontinence directly?
Well, there aren't drugs to magically fix damaged nerves, unfortunately, but some meds can help manage the symptoms. Opiate-based drugs like diphenoxylate or loperamide, yes, like the human antidiarrheal, can slow down how quickly stool moves through the gut.
How does that help?
By slowing transit time, it allows more water to be absorbed from the stool, making it firmer and potentially reducing the frequency and urgency.
Okay. But are there downsides?
Yes, definitely precautions. They shouldn't be used if the diarrhea might be caused by an infection or toxin, as you don't want to trap that inside. Caution is needed with liver or respiratory issues, and they're generally used less often in cats. Plus, side effects like constipation, bloat, or sedation are possible.
Okay, so not a simple fix. What about for reservoir incontinence?
If inflammation like IBD or colitis is suspected, anti-inflammatory drugs like steroids or sulfasalazine might be used to treat that underlying inflammation, which could then help the incontinence.
So treating the cause again.
Exactly. While treating things like fistulas or IBD might improve continence, there isn't really a specific drug for neurogenic incontinence itself.
Understood. So what does follow-up look like for these pets? And what are the ongoing challenges?
For pets with neurological pauses, regular neuro exams are crucial to monitor progress or any decline. Repeat imaging, EMG, maybe CSF taps might be needed depending on the case. Ongoing monitoring of stool consistency and volume is vital, often requiring tweaks to diet or medication.
Constant adjustment.
Often, yes. And the guide is realistic neurogenic sphincter incontinence in particular can sometimes just not respond well to treatment despite everyone's best efforts. That high euthanasia rate mentioned earlier is a stark reminder of the challenges.
Yeah, a difficult condition for everyone involved. Okay, this has been a really comprehensive look at a challenging topic. So, pulling it together, fecal incontinence in dogs and cats, it's complex. It can stem from issues with the rectum's storage ability, that's reservoir incontinence, or problems with the anal sphincter muscle itself, either due to physical damage or, very often, nerve issues.
That's a great summary. Neurogenic causes seem particularly common and complex.
And getting to the bottom of it requires careful detective work from the vet, detailed history, thorough physical and neurological exams, and often specific diagnostic tests.
Absolutely. Pinpointing the cause is key to finding the best way to manage it.
which leads to tailored management, whether it's treating the root cause, dietary changes, medications to manage symptoms, or other supportive care.
Right. And the critical point for anyone listening,
Yeah.
if you see any signs of inappropriate defecation or leakage in your pet, please talk to your veterinarian. Don't ignore it or assume it's just bad behavior. Early diagnosis makes a difference.
Excellent advice. Okay, let's wrap up with a final thought for our listeners. Considering the really wide range of causes for fecal incontinence, some of which are still quite difficult to manage, what future advancements in veterinary medicine, maybe in diagnostics or treatment, could offer more hope, particularly for those pets where the underlying cause is elusive or currently untreatable? What might give these pets and their owners better long-term solutions and quality of life down the road? Something to think about. Thanks for diving deep with us today.